Everyone, good morning everyone. Today let us learn about the quadrants of the abdomen. The abdomen is divided into 9 regions by drawing two horizontal and two vertical imaginary lines. The two vertical lines are drawn by joining the mid-clavicular point to the mid-inguinal point. As you can see in this figure, the mid-clavicular point till the mid-inguinal point. The upper horizontal line is drawn at the lowermost bony point of the rib cage, usually at the 9th or 10th costal cartilage level. The subcostal plane will correspond to the body of the lumbar 3 vertebra, while the lower horizontal line is drawn at the upper border of the tubercles of the iliac crests, which is the transtubercular plane, and it corresponds to the upper border of the lumbar 5th vertebra. Now the 9 quadrants of the abdomen are shown in this figure. Now depending upon these 9 quadrants, these are divided in such a way that each of the quadrant corresponds to a particular organ or gland of the body, and depending on that we can diagnose various diseases. Now these 9 quadrants are divided as follows: the right and the left hypochondrium, right and the left lumbar, and right and the left iliac, while the central region consists of epigastric, umbilical, and hypogastric regions. Now, when we talk about the right hypochondriac region or right hypochondrium, the body parts or the body organs which are corresponding there are liver, gallbladder, right-sided kidney, and the small intestine. When we talk about the left hypochondriac region, the body organs are spleen, colon, left kidney, and the pancreas. The pancreas is the most important along with the liver and the spleen, as well as the kidney and the stomach, because the pancreas mixes its pancreatic juice along with the juice from the gallbladder, which is the bile juice, and they together come into the common bile duct, thus making the acidic food turn into alkaline. Now the right lumbar region pertains to gallbladder, liver, and the right-sided colon, while the left lumbar region pertains to the descending colon as well as the left kidney. Then the right iliac region corresponds to the appendix and the cecum, while the left iliac region again corresponds to descending colon and the sigmoid colon. So the descending colon, if there is some pathology in the descending colon, then the patient might be having a pain in the left lumbar or the left iliac, or in both of these regions. So next come to the middle quadrant, the epigastric region and the hypogastric region. The epigastric region corresponds to stomach, liver, pancreas, duodenum, spleen, and the adrenal glands. Then the umbilical region corresponds to umbilicus, that is the navel, parts of the small intestine, as well as the duodenum, while the hypogastric region corresponds to urinary bladder, sigmoid colon, and the female reproductive organs. Now you will see that a patient who is with hernia, a male patient, he usually has a pain either in the right iliac region or in the left iliac region, while a female having any kind of reproductive problems will be seen to have pain or discomfort in the hypogastric region. Now let us come to the diagnosis depending on each of these areas. Now when you will talk about the right hypochondriac region, we have problems such as the organ there is liver. So we have first hepatitis, then liver contains the gallbladder, so gallstones, cholangitis, that is inflammation of the cholange, that is the gallbladder, inflammation of the gallbladder, and cholecystitis, As inflammation of the colus, that is the inflammation of the gallbladder along with the formation of a cyst, cholecystitis, as well as the liver abscess. The liver abscess is very much characteristic of patients having excess of alcohol as well as uncontrolled diabetes. The uncontrolled diabetes condition can also occur due to excessive non-vegetarian diet. Next, the second quadrant, which is the epigastric quadrant. Now let us move into line 1st, 2nd, 3rd, 4th, 5th and 6th, 7th, 8th and 9th quadrant. So now let us look at the second quadrant, which is the epigastric quadrant. Problems here occur are peptic ulcer, gastroesophageal reflux disease, gastric cancer, because all these pertain to the stomach. Then esophagitis, or you can say reflux esophagitis, which is the common condition called as acid reflux. Then pancreatitis, inflammation of the pancreas. Next, in the left hypochondrium region, we have splenic abscess, splenic rupture and splenic infarct. So mostly spleen problems are mostly diagnosed based on the trouble or the pathology or the pain the patient tells us in the complaint in the region of left hypochondrium. So it will have the problems mostly related to the spleen. The left hypochondrium region will have problems mostly related to the spleen, which is splenic infarct, abscess and the rupture. Because spleen is a graveyard of RBCs, and if the RBCs are not able to renew themselves, then some kind of pathology occurs in the spleen. It is an indicative that some pathology is present in the spleen, because of which the RBCs are not able to renew themselves. Next, the right lumbar region. 1 minute. The right lumbar region, the renal colic as well as the pyelonephritis. Next, the umbilical region, where the umbilicus is present, which is very important. It is also known as the center of gravity of our entire body. The problems here pertain to appendix, that is early appendicitis, mesenteric adenitis, the adrenal gland adenoma, salivary gland, mesenteric adenitis and Meckel's diverticulitis. Meckel's diverticulitis is a very much rare but a common complication, which is very difficult to cure. Next, the left lumbar region shows renal colic as well as pyelonephritis. So pyelonephritis can be seen in left as well as right lumbar regions. In right iliac region, we have late appendicitis. So when the patient has a pain in umbilical region, there is early appendicitis. When the patient has a pain in right iliac region, we have late appendicitis. Crohn's disease, ectopic pregnancy and ovarian cyst. Then the hypogastric region, UTI, urinary tract infections, urinary retention or testicular torsion. While the left iliac region has simply diverticulitis. The umbilical region had Meckel's diverticulitis, while the left iliac region has only diverticulitis, ulcerative colitis, ectopic pregnancy and ovarian cyst. The other two complications are in the right and left iliac region pain are usually hernia, which are seen in most of the male patients, which occur due to excessive carrying of the weight. So this was the diagnosis based on the 9 regions or 9 quadrants of the abdomen. Thank you. Enjoy your tea.